welcome back to Bottles, Booze, and Feeding Tubes. MPT here, the rebel mom and family nurse practitioner. If you're new to this channel, we'll be talking about all things primary care, pregnancy wellness, postpartum, parenting, and pediatric care. Today, we will talk about the top 5 questions you should ask your primary care provider. Question number 1, what tests should I have? There are a lot of tests that we normally provide on your annual physical. This would include blood work. Some could be checking for diabetes. We check for cholesterol, high cholesterol. We check your liver function, your kidney function. I like to throw in a vitamin D panel because I've noticed a lot of deficiencies in vitamin D. Some of the other tests I think everyone who might be sexually active should get would be an STD screen, and those can be done every 6 months to a year. As we get older, there are some common screening tests that you should look into getting. Bone density, that checks if you're at risk for osteoporosis. You can do breast cancer screening test, cervical cancer screening test. Those can be done along with the annual STD testing, colon cancer screenings. So there's a lot of tests that you can get, and most of them are based on age. So ask your provider what tests you are due for. Another common question I get is, how long should I take this medication? Well, that's a harder question to answer because you have short-term and long-term medications. Short-term would be like an antibiotic for an infection that was actually bacterial in nature. You would want to complete the entire course, and there's usually not a second or third course. Long-term medications would include medications for blood pressure, diabetes, and you would want to keep taking those until you and your provider discuss an option for getting off. I've had patients come in to an appointment and their blood pressure is high, and when I'm talking to them, they're telling me that, oh, my last visit, my blood pressure was good, so I stopped taking it. No, you need to discuss this with your provider. It should be a joint discussion and also weighing out the pros and cons. Sometimes if you're on these medications for a chronic condition and you start doing lifestyle modifications and improving your health with physical exercise and nutrition, then you may be able to decrease the amount of meds or come off your medications. But again, those are decisions for you and your provider to make. What are these medications for? That's a very good question, because if you don't know why you're taking the medication, you may not continue to take the medication. Again, short-term medications, say your vitamin D was low and your provider gave you a supplement to see if it increased it, and after you're done with that amount, you're done. Sometimes they'll give you a maintenance to continue taking it. So it basically depends on the kind of medication that you're on, but you want to keep taking these medications as prescribed. A trick is to read the bottle. Sometimes there are medications, the dosing amount, how often you should take it, and how long you will take it is an indicator. If you see there's refills on there, you probably should continue to take it until you follow up with your primary care provider. Or if you're having symptoms of a reaction or side effects, definitely get in to see your provider and maybe they can change those medications for you. What can I do to improve my health or decrease my risk for chronic conditions? That is one of the main questions I feel patients should go into their appointment with, because this is a team effort, and if you are willing to take an active role in managing your health, then we can collaborate on the decision-making process. So the things that you can do to improve your health is getting physical. If you don't like to do traditional exercises, find activities that you do like to do. Pickleball seems to be on the rise. Basketball, if you like that. If you just like to walk. Yoga, swimming. Swimming is a really good one if you have a lot of joint issues. You can get in there, you're light on your body, and you're actively working out. So find activities that you enjoy that doesn't feel like exercise. Nutrition, I tell people all the time, don't try those restrictive diets. I mean, if it works for you, it works for you. However, most people will get off the diet and go back to their normal routines. You will want to eliminate things slowly so that you know that you are staying on track and you're not getting rid of all the things you love and feeling like you're depriving yourself of all the good stuff. So slowly eliminate something, find something that you're ready to be like, you know what, I can give that up first. Soda, if you're eating out 5 times a week, decrease it to 2 times a week. Don't do everything all of it once. Your healing process is a journey. You didn't get unhealthy overnight, and you're not gonna get healthy overnight. So please make it a process and then slowly eliminate things. Hydration, the number one thing I see a lot of problems is with not being hydrated. Especially in Arizona, heat injuries, UTIs in women are really high in my patient population because of the lack of water drinking. So ensure you're drinking the proper amount of water. Sleep, I know that's a hard one because we're so busy, we're always doing stuff. You might have kids, you may not have kids, you might have pets that wake you up at 6 o'clock in the morning to go out for their daily walk. Whatever is keeping you from being able to get good sleep, try to find good sleeping patterns and a routine so that you can get your sleep, because during the sleep time is a time where your body starts to repair. Self-care is a big one. Finding things and activities that you really enjoy that has absolutely really nothing to do with your health, but it does improve your mental health, because mental health and physical health goes hand in hand. So if one is not in alignment, then the other one won't be as well. And the last question, now that we're talking about mental health, how do I talk to my provider about my mental health concerns? First, be open and honest about your feelings, what's going on, the thoughts that might be coming to your head. Share your symptoms that you're noticing so that we can definitely discuss what might be going on with you and treatment options for you. Write down your symptoms and your feelings. Take notes. You may wake up one day feeling very anxious and you're not sure. Write it down, put the date on there so that you can reference back to it when you're talking to the provider and jog some of the memories and the feelings and the symptoms that you were having. Did you wake up sweaty? Was your heart racing? Did you notice you were more tired this day? So write down your feelings and bring that into your appointment. Bring someone with you, someone who may know what you're going through, or just someone to be there as a helpful person, a support system for you to lean in as you talk about these feelings with your provider, because it's not easy, and having someone there to hold your hand figuratively and literally may help you be able to be open and honest with your provider. I always say this: ask questions, ask questions, ask questions. Write down your questions before your visit. As questions come up, if you're in the middle of a thought, write it down and then ask later. You won't know the answers until you ask. And finally, have goals in mind of what you would like your overall health and well-being to look like. Your goals will come from you, and if they come from you, more than likely you'll stick with them. So if I'm telling you that you should lose weight, but your real goal is to be more active so that you can run around with your child, you may not worry about the weight so much right now. You're just looking to be able to get active and move around better. So know what your goals are so that we can help establish a plan for you to improve your health. Thank you for watching this Rebel Mom's journey into holistic healthcare. If you have any other questions, please leave them in the comment section below. Join me on the next video as I continue to help all you Rebel Moms out there on your journey to holistic health and well-being.